Well, I'm glad we heard about the Jenny McCarthy body count and the pseudosciences you've never heard, and dietary facts that went before. All of this it's a great introduction to what I'm going to be talking about. This is really a basic talk, and I'm sure I don't have to sell a crowd of skeptics on vaccinations, why they're important. Just a bit of history. When we talk vaccinations, we can use the terms vaccination and immunization interchangeably, which is a little bit different from an inoculation, which actually uses the unweakened live pathogens. One of the first recorded instances we have, although this goes back to people trying to use some kind of inoculation, goes back to about 200 BCE in India and China. Lady Mary Wortley Montagu, she was the wife of an English diplomat, and they were over in Turkey. And while she was there, she noted that Turks inoculated themselves against smallpox using the live fluid. They would take a little stem from the live pustules and then inoculate their children with that, and there was less of the disease. So this is kind of the first observational scientific instance that she's looking, it actually makes a difference in how many people are affected by smallpox. She'd actually had the disease earlier herself as a younger woman. So she decided to try it and found out that it worked. Brought it home back with her to England. However, they kind of ignored her for the first part, partly because she was wasn't a doctor, and in part because she was a woman. So this was in 1718. The breakthrough came in 1724 by Dr. Emanuel Timony, who had been their family physician in Istanbul. So he wrote the scientific description of it a bit later on than her. However, what we know, but basically, is vaccinations work. They work. One example is polio. Pre-vaccine, there were 13,000 to 20,000 cases of paralytic polio in the U.S. every year. This is the type of paralytic polio that leaves victims, usually children, in braces, crutches, wheelchairs, iron lungs. The effects are lifelong. It was in 1988 the World Health Assembly pledged to eradicate polio worldwide. That was in 1988. There were 350,000 cases in 125 countries. By 2006, 2,000 cases in 17 countries. There are only 4 countries left in the world where polio is still endemic, but it's currently eliminated from pretty well half the planet: Western Hemisphere, European, and Western Pacific regions. The one thing to add, though, about vaccinations is that they're not without risk. They're not risk-free. We do know that. They're not 100% effective. There is a small portion of the population that will not get a benefit from a vaccination. And they're not for everyone. If you have an immune disorder, or if you have an organ transplant, they're going to say, no, this is not for you. Or if you have an allergy, a life-threatening allergy of some kind. Side effects range from mild to life-threatening. When we had the H1N1 vaccines here in Winnipeg last year, I was a good doobie and went and got my vaccination. That was the first time, actually, that I'd noticed I had a really sore arm for about a day. But that's all. And for the first time, I think I talked to 4 different people, and they all had that side effect. But it was very short-lived. It was only a sore arm. It went away in a few hours. Severe effects do happen, but they're in the range of about 1 in 200,000 to 1 in 1 million doses. So when you weigh that against the benefit, you weigh that benefit against the possibility of getting a possibly life-threatening disease, it's, we're still going with the vaccines. Since we've developed them and vaccinations have come into common usage, there are now over 20 diseases that we can be vaccinated against, and some of these are relatively new. The HPV vaccination, of course, is relatively new, but there's a wide range, and most of these, of course, we get in childhood. So as another example, kind of just a case study of a disease that we can vaccinate against now, I'm thinking about whooping cough or pertussis. This can be a pretty severe illness. It results in prolonged coughing spells. They can last for weeks. It affects mainly children. It can cause pneumonia as well. It can lead to brain damage, seizures, mental retardation. It's had a up and down history. But recently there's been resurgences. Before immunization, almost everybody caught whooping cough. There were up to 150,000 to 260,000 cases per year, with up to 9,000 related deaths. Once the vaccinations have hit from 2000 to 2008, 181 people died from pertussis. However, 166 of these were less than 6 months old. So this is something that hits children, infants, very hard. This is what started, yeah?
I'll just ask, at what age do they vaccinate?
It's approximately 2 months to 3 months.
Oh, okay.
I'm not certain.
Okay, thank you.
Yeah, that's when vaccinations start. It came to my attention recently because I keep reading the newspaper and I saw the headline about whooping cough in California, knowing that's where Jenny McCarthy is based, and thinking about her influence. Now, 4,000 people infected, killed 9. Infections continued to rise. And on September 2nd, the Public Health Agency of Canada actually issued a travel health notice. That's a 7-fold increase in the number of whooping cough cases in California this year. This is a little bit of a note I found from the CDC the other day. During the 6-month period starting January 1st to June 30th of this year, there were a total of 1,337 cases in California, a 418% increase from the 258 cases reported during the same period last year. So they are having a large spike. This little fellow, I was just looking at CNN yesterday and noted his story was one of the top ones on there. His name is Carter. He was 5 weeks old before he had been vaccinated. He is from South Carolina, actually, not California in this instance. And when did he pass away here? His parents noticed he'd had the low-grade fever, didn't have any other obvious symptoms, but he got, they took him to the hospital, about 30 miles away in Charlotte, North Carolina. His heart started racing, but his blood pressure was pleasantly low, then the cough started. There was nothing his parents did in this instance. This was a case where he was only 5 weeks old. He was too young to actually be vaccinated at this point. Okay. Left or into left? Okay. Bad weather had kept the family from traveling since he was born. And his parents realized this, so the infection only could have come from the parents, his 10-year-old brother, or the pediatrician's office. Yeah, so we don't know. It's a horrible, guilty feeling as his mother. This is from his mother, Felicia. I'm the one who's supposed to protect him, and I could have been the one who gave it to him, she said. That's something you just don't shake. So, tragic story. Those numbers are real. This is a real family hit by this tragedy. So we get a little closer. I'm noticing we had some information from Saskatchewan. 120 cases so far this year in Saskatchewan. This is from September as well. Since January, there have been 120 cases. And then it hit Manitoba. I noticed this story in the Free Press September 11th. 8 Manitoba kids hospitalized. Vaccination rates among the Manitoba First Nations are generally lower than the provincial average. The average in the province is 80%. The rate on the reserves is only 60%. Now, during my research on this, I discovered, of course, what you call herd immunity. So there's some more information. Introduced in the 1940s. So again, we've had that bit of a rise and dip in Manitoba recently. Herd immunity levels, though, vary by the disease itself. It occurs when a portion of the population or the herd is actually vaccinated. If there's enough people vaccinated, then that gives protection to the unprotected individuals who have not been vaccinated. The threshold rates vary anywhere between 75 and 95%. For whooping cough, the threshold is 92 to 94%. So if you look back at the figures in Manitoba, we're very low, 80 to 60%. So I started wondering why. And what I did as part of my quest here, I actually wrote to Joel Kettner's office. He's our head of the MR, Manitoba Regional Health Authority, the Winnipeg Regional Health Authority, asking, do they know why these rates are so low? And unfortunately, like any good government office, they didn't give me a good answer. Very, very, what you call it? Safe kind of answer, no definitive things. They mentioned the following, though. They mentioned personal beliefs of people who may, not consider vaccinations a good option. They did mention the influence of anti-vaccine advocates, the perceptions of vaccine benefit and safety. And there's some parents who read literature and really kind of debate, should I have my child vaccinated or not, and decide against it because it's not 100% safe. But then nothing is. There is always a possibility that you're going to be the 1 in a million who is going to have a major adverse reaction. You may have a life-threatening allergy and anaphylaxis. The flu vaccines, they're always asking you if you're allergic to eggs, because they cultivate those in chicken eggs. So if you have an allergy, you can't take it. And then what I was more curious about in Manitoba is practical barriers, lack of access to health care. I know that the reserves up north, that's already an issue for any type of medical care, never mind vaccinations. A little bit later after this, I also noticed a story in the newspaper there. Nurses were trying to do an inner city study on getting women prenatal care, and there was a certain population, especially that weren't even getting any prenatal care at all. They were going ready to give birth, and they hadn't even seen a doctor yet. So I'm figuring, what chance does that have then? How many of them are going to actually have their children vaccinated on schedule, you know, once the baby arrives? So these are things to be concerned about, and my situation or my attitude is, okay, what can I do? I hate seeing this kind of thing. I'm trying to do a little more research. Manitoba Health does send out automated reminders. I was thinking, well, why can't we phone people? Why don't we mail them and tell them this is an important thing? The province does do that. They actually keep an entire list as well. We should all be aware, ensure our own vaccinations are current for our own selves. How many people have children here? Vaccinations current, everybody?
Yeah, even
Your kids are old.
Your
grandchildren, yes, of course. It's nothing to tell people, you know, have you got the kids vaccinated? Are you going to? It's a good idea. Here's why. Take action where you can. Here's my personal example. At where I work, Manitoba Lotteries, we offer a benefit program for our pregnant employees. It's a little program called Babies Are Best. So we, when they come in, they get all the mat leave finalized and stuff. We send them off a little baggie, a bag of stuff, maybe a couple little children's books, some pamphlets. What else does she include? Information, things. What I'm going to do and what I've suggested is that we include the inoculation information when they leave as well. We're going to put that in there. We're going to make sure they've got the information, they've got the schedules, they know why it's important and why they should have their babies vaccinated. And that's it.
Wonderful.
Any questions?
I think a wonderful presentation, by the way. I followed the issue of human papillomavirus vaccination in Canada.
Yeah.
And watched how the Catholic Church had lobbied against parents in Catholic schools. So sorry, I'm rephrasing. They convinced parents in Catholic schools not to vaccinate their children. And by the time it was all said and done, the vaccination started in the East Coast and they went to the West Coast.
Okay.
Not on purpose. I followed the news stories, and what I found was there were over 10,000 Catholic schoolgirls that did not get their vaccination specifically because of what the Catholic Church told them about HPV vaccinations. So I took the medical stuff from the website about the prevalence rate of cancer following HPV and figured out that there were going to be between 5 and 50 Catholic schoolgirls who would have cancer as a result of not being vaccinated.
Wow.
And this goes back to what Art Schaefer was talking about before, is that dangerous beliefs, or belief is one thing, action is another. And I honestly think as skeptics, as a humanist, that these are the types of issues that we should write letters to the editor about and simply state it plainly. You know, so I wrote a letter about it, but I think I love your topic, by the way. That's okay. I'll leave it at that.
Thank you. Okay.
Another comment, actually, a lot of people think like if they had their vaccinations when they were younger, then they're good to go. But if you haven't had a pertussis vaccination in the last 10 years, you're not up on it anymore. And I have a personal stake in it because the pertussis vaccine, I'm allergic to it, so it's the only one I haven't had.
Right. So you want to make sure that the rest of us are vaccinated.
Right. So I mean, if herd immunity isn't kept up, then I'd rather not get it, thanks.
Well, exactly, and a lot of adults don't know that we should still be getting certain vaccinations, and they don't always last. Tetanus is one. Again, it lasts 8 to 10 years. Yes?
I just have a quick question going with what Ashlyn said. Manitoba Health has a list of which vaccinations we've had. Do they send out those reminders to adults, or do they stop once the kids
No, they stop at about age 5.
Okay.
Yeah.
Because that's something else we could do to get it sent out to adults as well.
Well, exactly. I mean, I don't even know what I got vaccinated against.
Yeah.
If I could ever go back, how many years? Yeah. I'm not going to say, but
yeah.
A long time ago, I don't even know what I was vaccinated against or what I've had too. So
you can get a printout of that.